OCD, or obsessive-compulsive disorder, is a mental health disorder that affects people of all ages and occurs when a person gets caught in a cycle of obsessions and compulsions. OCD takes control of your body, making you feel like you have to fix or change everyday items or things. You tend to make things the way you want them to be by doing everything twice, more than once, because in your mind, it wasn't good enough the first time.
OCD doesn't have an age. Any person can get OCD at any time. You cannot prevent it from happening. There are many treatments to OCD like behavior therapy, antidepressant medication, and surgical severing of the cingulum. OCD is a brain disorder, therefore parents raising teens and children cannot do anything to cause or prevent it necessarily. Although OCD may not be preventable, it is manageable and easier to handle the earlier you are diagnosed.
Manage the stress OCD can cause. Make sure to get enough sleep. And also practice relaxation exercises like meditation, yoga, and deep breathing. Stress and anxiety can trigger OCD symptoms and even make them worse. It is important to manage them. 2/3 of people with OCD suffer from depression sometime in their life. Depression often forms from the ongoing distress OCD causes to people in their daily lives. When OCD is being treated with medication by a doctor, antidepressants are often prescribed because they are closely linked. That medication tends to help both the OCD and depression of a person. In Minneapolis, there are tons of specialized OCD therapists who can help people manage and overcome OCD. There are also treatment programs in Bloomington, Uptown, and Rogers that use a multi-module treatment approach to deliver sensitive, age-specific, intensive psychiatric care for children and teens dealing with OCD and other mental health issues.
Teens with OCD reach out for help because if OCD continues for a long period of time, it can have many negative effects on your body. Chronic OCD has led to heart disease from the exhaustion put on by the obsessions and the compulsions. OCD can also lead to skin infections and constant agitated feeling.
Your genetics, the environment, and abnormalities are major influences of OCD. People with direct family members with OCD are at higher risk of developing OCD themselves. People who experience abuse or other types of trauma in their lifetimes are more susceptible to getting OCD. And abnormalities in certain areas of the brain, such as the frontal cortex, have resulted in higher risks of OCD as well.